Good morning, everybody. Welcome back. Because it is our first Anchor of Hope of 2022, I did just want to provide a brief introduction of what Anchor of Hope is. I know many of us who are here today, we are very familiar, but just in case we have any new viewers this year, I just wanted to introduce Anchor of Hope a bit. So just for those who are joining us for the first time, you are joining Anchor of Hope, which is a wonderful discussion, talk, learning opportunity that we provide. And this year we actually are changing it to be a once a month sort of thing. And so hopefully you can dedicate just a quick Saturday morning once a month with us. It'll normally be, I believe it's going to be like the second Saturday of each month. And our time is changing a bit. Up until last year, we were connecting around 10:30 to around noonish, but starting this year, it'll be the second Saturday of every month, and we'll start a little bit earlier at 10 o'clock, just in time, right? That sweet spot between your Saturday brunch and your Saturday lunch. So I hope you can join us once a month. And pretty much the goal of Anchor of Hope for us is it's a place that anyone who's interested in improving their overall mental well-being, but also incorporating the powerful message of the gospel truth of God's love. Anyone who's interested in experiencing the kind of hope and healing that comes from learning about Jesus, that's what Anchor of Hope is for. And so the phrase that we like to use amongst our inner circle here is we really want to see the integration of mental health knowledge and the integration of Christian faith. And so welcome anyone who is interested in that. I just wanted to point out, if you were interested in any of the past topics that we've reviewed in past years, thanks to COVID, we have all of them recorded and uploaded to our YouTube channel. And so you can look us up on YouTube, Oak Health Foundation, Anchor of Hope, or you can also visit our website, which is www.oakhealthfoundation.org. So feel free to visit us there, but I'll stop talking because I want to introduce our new series that we're starting this year with. So we're going to be tackling topics of like the most common mental health diagnoses or issues out there. And I'm really interested to learn all of these different topics, because when we just hear these topics, like for instance, today we're going to be visiting the diagnosis of Attention Deficit Hyperactivity Disorder, commonly known as ADHD. For me personally, when I hear that, I'm thinking, how does this integrate with Christian faith? What are those two have anything to do with each other? So I'm really, really excited to learn about this topic today. So yes, before we get started though, let me go ahead and open us up with a word of prayer, just because we need God's guidance through all of this. So let's pray. Heavenly Father, we just want to thank you so much. God, we recognize that we easily go through this life, diagnosing things, finding the scientific reasoning behind all of the things that we experience in our lives, Father. But we really want to recognize that ultimately we are really at your mercy, Father. Even things like ADHD, God, we recognize that there is a message in that as well. And so, Father, would you just fill us with your spirit today? Help us to come with eager, learning hearts to hear and to be encouraged, and just to walk out of today's Anchor of Hope more empowered to be able to recognize the spiritual battle that goes on, even in things like ADHD. So would you just be with our speakers today? Help us to just receive your message. Thank you so much for loving us and for your grace. And in your name we pray. Amen. So without further ado, I wanted to introduce to you guys our presenter today. We're welcoming back awesome Dr. Mijin Park, and she's going to be tackling the integration of not just the scientific aspects of ADHD, but really integrating that into Christian faith. So thank you so much, Dr. Mijin. I'll let you have the floor.
Good morning, everyone. Thank you so much for joining us on Saturday morning. And I'm very, very happy and the honor to start our first Anchor of Hope, the topic of ADHD, and being a speaker today. So the ADHD is very well known in public, actually, right? So everyone knows what ADHD, everyone is talking about it. Jokingly, unjokingly, we're all talking about, oh, I am ADHD, oh, I have that symptoms, that's me, right? So even when you are actually going on the social media, some of my patients brought some TikTok video clip or Instagram video clip or YouTube video clip, and then they were telling me that, oh, Dr. Park, I just want to show you this clip because this clip is describing me. I don't have to explain to you everything, just listen to this 2 minutes video clip. And I said, okay, and listening to that, and then that's me, right? So that's oftentimes what I'm encounter in our office. So it is a very hot topic, but I think it will be good for all of us to understand what ADHD really means, all right? The clinically and scientifically, and also how that ADHD can impact an individual's life and also people around them. Then how can we help them to really experience the fullness of who they really are, right? Away from, or even with that diagnosis that they are having. So let me share. I will actually share the slides in the beginning for the educational parts, because the ADHD, we kind of needed to understand well what this is in a clinical matter. And then after that, I will stop the slides or a screen, and I wanted to speak from my heart that what I believe beyond the diagnosis of ADHD. So let me share my screen with you. Okay, so what is ADHD? Again, we just talked about it. Everyone knows what it is. So let me just go into the little bit of the paradigm shift, how ADHD has seen before and now, right? But I think a lot of our adult side, or especially parents, are still embracing the definition of ADHD in an old way of viewing it. So the clinical research have dramatically changed the old understanding of ADHD, essentially a behavior disorder. Again, the long time ago, the ADHD is all about the behavior. They cannot control themselves. They always cannot sit still. They're just running around, right? So that is purely is a behavior issues that they're looking at. So, that's why I think some people are try to avoid the ADHD H part, the hyperactivity impulsivity part disease. They're just saying, oh, ADD, I'm more ADD, because they don't have a behavior problem. So then why we are struggling even without the behavior part, that many of the children and adolescents and adults are still struggling with attention deficit piece. So the finding from the neuroscience and brain imaging, this is the beautiful parts of the technology. The ADHD is no longer is only behavior issues. There is a partially is a behavior issues are associated, but is more of a developmental impairment of the brain self-management system. The key is here is a brain, right? It is not about the behavior, but this is the developmentally impairment. So let's just kind of focusing on what that really means. The brain, I often share with my students and then adults in the sessions. Let me share the hand model of the brain. Is Dr. Daniel Siegel used the brain hand model using, or explaining about all this disorder. So let me just share a little bit of our brain. I will go in a little bit more in detail later. But if it is a developmental impairments of the brain's self-management system, we needed to understand the brain too. So this brain, this is a hand model of the brain, is a one hemisphere and then another hemisphere together. This is the brain. But when children are born, within 2 or 3 months, their size of the brain is exactly or almost the same size of the adult. The brain size is similar to the adult size, but the function of their brain is not fully developed yet. The brain is developing by aging. Right? So as the time goes by, as they get older, the part of the brain and function of the brain is developing. But for the ADHD, people who are diagnosed with that, the parts of the brain expected age that when they needed to develop or understand is not fully developing yet. That's why they're struggling and facing some challenges for their age-specific area. So for example, if they're kindergarten, teachers are expecting in a certain way, but our children cannot manage, just sit still on their chair, or they're blurting out when they needed to raise their hands. Then teachers say, oh, something is going on with your child, right? So it's a brain is developing in a specific age and the matter, right? The milestones. So that's something that again, I will bring it up more, but I just wanted to pointing it out what that developmental impairment of the brain means, right? So that brain is still developing. Some of our adults are still in development, I guess, but scientifically, our brain is fully developed around the age of 26 and 8. So let's just remember that. Again, I will bring it up. But the ADHD, if we are looking at in this matter, it's not a behavior issues, it's a brain functional issues. We needed to understand the parts of the brain is controlling related to ADHD behavior, right? So the parts of the brain, I'm gonna go a little bit more in specific, but that's the part, the executive function. So what ADHD development of their brain is delay is suffering in the executive function area. Executive function comes with time management, prioritization, emotional control, organized, right? All those things comes together to help us to daily function. In DSM-5, right, in 2013, they're kind of changing it and all those things. But in DSM-5, the ADHD section actually comes with the 3 categories. But when we are giving patients, either child or adolescent and adult, giving this diagnosis, we are looking at that is basically the brain-based condition that makes it hard for our children and adolescents and adults to concentrate. Using their working memory is tough things. So working memory means if they are doing something, they have to remember what they were working on. So when they are distracted by something else, they needed to come back to what they were, right? So what they were doing they were distracted by something, they come back and they're continue to complete. But the people who are struggling with ADHD is very, very weak on that. They forget after they are distracted, right? So, but all these areas that we're looking at is a brain-based condition. Again, neurological issues. It comes with 3 types. This is a very important part for us to understand when we are diagnosing to the patients, we are giving them these 3 categories. Either you are too hyper, too impulsive, right? So everything else seems like okay, but you don't know how to manage or inhibitory control issues. So oftentimes that area can be seen as a behavior problem, right? And then children who have this type often comes to our clinic and to our session very early on, because everyone noticed that they cannot sit still. They are blurting out and they cannot get along with their friends because they were very impulsive. So people who are predominantly on the hyperactive and impulsive, they come early on. But if people are on the other type, inattentive type, parents often were telling me, oh, my children don't have ADHD because they know how to focus, right? And then they're sitting on and on for a long time until you tell them get up. They can sit still. They don't have ADHD. But you know what? Inattentive type means your body is there. Again, but this is a brain functional issues, right? Their mind is not there. Oftentimes, all the children and adults were telling me when they're having predominantly inattentive, they'll say, I was listening, I was looking at my teacher when they're giving a lecture, but I am daydreaming at the same time. And my mind is scattered all the place. I'm thinking about constantly what can I eat for later? You know, thinking about the video game that they wanted to play later. They're thinking of all those things while their teachers, their friends are talking about something in the group. So sometimes you just needed to, hey, come back, right? But oftentimes inattentive type, they don't come early on because we're missing that. But our children are struggling so much in this scattered mind and inattentive type that they have to read their paragraph over and over and over again in order for them to understand one concept. Because it doesn't stick in their mind because of that distracted, scattered mind that they have, right? So oftentimes our children are telling me that, yes, I know I needed to study, you know, the 30 minutes, so I can do the 30 minutes, but it takes 3 hours for them because they have to redo it again. Often comes with a careless mistakes with this. They know the concept, but they missed the one symbol, and then they cannot get the correct answer. They understood one part, but they couldn't understand another part because they're distracted in their mind, right, for something else. And also another type is a combine, these two together. Right? So again, that's how we are diagnosing and giving to our patients. Again, as we just talked about it, ADHD is not only behavior issues, not only attentional issues, is a neurologically based disorder that reflects how the brain is wired and functioning. Please remember that it's a neurological based disorder, which means it is not about what they don't want it to do. It's not about the behavior they cannot just control. It's how their brain is affecting each other, right? How their brain is wired and functioning. So many studies actually show that brain chemical, especially for the ADHD, is dopamine. Dopamine. Again, dopamine. What does dopamine do to our brain? It brings the pleasure. So this dopamine may play a role in ADHD. It is linked to many functions. Again, dopamine. It is including our movement, right? Our sleep and mood and attention and learning. But think about it. Many of our children and adults were saying, I'm not motivated. Many of our children's parents say, can you help my children to be motivated? How can we motivate them when they're not having fun? When their mood is not good, how can we motivate them? Again, that dopamine is giving us good pleasure, good feelings. So the ADHD highly linked to, associated with this dopamine level. No wonder many of our children are getting into the internet, a video game, because it's fun, because the pleasure they're getting out of the games or social media shooting to their brain at the dopamine. Now, something that they cannot have within their brain, they're getting it from the outside. They have to stimulate it in some way to fill the gap in their brain so that they can do that. That's why they were hyper-focused on that area. Again, dopamine. And then it will come back to that. Interesting thing is today, this week, I have one child. He's 14 years old. And then he was telling me, Dr. Park, it's so weird. I am so happy, and I'm so happy. I am more motivated, and I'm having more fun. and I have a more energy, but everyone don't like when I'm happy. Because for some reason, my family members, my brother and my mom and dad are annoyed when I'm happy. But when I am bored and still try to control myself, seems like all my families are happy. So if I want to be happy, everyone will be unhappy. If they're happy, I'm not happy. So does that mean everyone don't want me to be happy? I said, oh, okay, let's talk about that. So kind of doing that. However, this week, and we're scheduled to meet and through the Zoom, right? We're meeting some of the older children through the Zoom. I was waiting and waiting, 10 minutes pass. And usually I'm waiting until 15 minutes before we call. So 15 minutes, and still not log on. So we call mom. Mom, what's going on? Your appointment is here. And mom says, sorry, I forgot. ADHD tends to run in families. Oftentimes our children, especially children who are struggling with ADHD, we cannot blame our children. How come you're not organized? How come you don't know how to manage your time and prioritize it and everything? Because parents who have ADHD cannot teach their children how to manage that. So studies have shown certain genetic characteristics that occur with high frequency in families where one or more family members has ADHD. So another research has proved at least 1/3 of all fathers or mothers who had ADHD in their youth have children with ADHD. This is the alarming. The research has shown that 11%, 11% of children were diagnosed with ADHD, but only about 4% of adults. Since ADHD isn't something most people outgrow, there is a glaring problem with only 4% of adults having a diagnosis. Even worse, look at this. Of those who were found to have adult ADHD, only 25%. So from the 4% of adults, only 25% have received treatment. If you do the math, again, this is one of the statistics we're sharing that. This means that there are 74 million adults in the US not receiving treatments for the serious brain disorder. Again, a long time ago, before the paradigm shift, ADHD was a behavior issue. So a lot of adults outgrow of these issues. Again, the impulsivity part and the hyperactivity part, because of the social norm and social expectations, their impulsivity and the hyperactivity part was controlled a little bit and compensating with other things. But the dangerous thing is here in the recent time, all our young adults and the adolescents, how they compensated about their hyperactivity and impulsivity part from the outside. Again, remember there's a dopamine, brain chemical imbalance. What they do in order for them to compensate their hyperactivity and impulsivity part, what they do is seeking dopamine from outside. A lot of outside of the drug is related to the dopamine. Alcohol, vaping, social media, and video game. Unfortunately, a lot of our young adults and the children, adolescents, are seeking something else rather than proper treatments because they don't recognize that this is a neurological brain disorder, but they were trying to compensating in some way. Probably you saw some people, they're listening to you, right? But they're shaking their leg crazy. I don't know, you saw many people like that, or they're touching and then they're tapping so many because they needed to stimulate it in some way that they cannot control. So they're creating those socially acceptable behaviors to compensate some of the areas that they're having. Oops. Okay. Oh, it does. I don't know how to do this. Okay, so, but all these issues, okay, I get that. This is the brain issues and the problem of all this. But the behaviorally, okay, they can maybe compensating in an outgrow. But what's happening that while they're developing their brain? So I'm coming back to our brain again. The brain where it controls the most of our attention, again, executive function, time management, prioritization, inhibitory control, all those happening in right here in frontal lobe, right here. Okay, so when you put your hands here, so from above the eyebrow to in the middle, right before the middle, that's what we call frontal lobe. This is outer side of the brain, is controlling all these managements, like a functioning issues. But our brain is not only comes with this outer side. If we are lifting this frontal part, or outer part, there's inner parts of the brain. What does inner parts of the brain do? Is controlling our emotions. But think about it, our brain is connected to, look at this picture, connected and affected to one another. Which means if we are not managing it well in our frontal lobe area, it will affect our inner parts, core of who we are. We're constantly anxious because I cannot make my project, but I do. Right? I cannot manage my time and constantly procrastinating it and delaying it. So instead of our brain is affecting now, I am anxious. And then also, I cannot meet my parents' expectation. My parents always want me to get A, but hours I'm studying, still I'm getting B. And then constantly evaluating and reflecting about themselves that I'm not good enough. That emotional part is now inner side of their brain is affecting and view of themselves. This is concerning. If we're looking at it as a brain chemical imbalance, we needed to kind of treat it that way, right? So again, this is one of the diagnoses among all diagnosis in mental health is highest rate of effective treatments. If we are treating early on, while their brain is developing, it can function it well, and then they can train themselves for the executive function piece. Okay, so no wonder all those people who are struggling with the ADHD people are struggling with their emotional piece. High IQ, again, research has proved that high IQ cannot exempt this executive dysfunctional issues and emotional dysregulation issues. Again, your brain can think and do it, but they cannot control their emotion. That's why people, especially in adults and children too, ADHD are very, very and acute difficulties with frustration, impatience, and sometimes too much of excitement. Again, emotional challenges, again, begin in the brain, is connected to everything in a network, right? So they cannot use or save the energy to planning and organizing and all what they have because they are seeking the other parts of the dopamine outside. Brain image also shows that children and adults who are struggling with ADHD struggle with the delay gratification. It has to be immediate. One of my child this week again was telling me, he's 16 years old. He was telling me, Dr. Parr, I had best week ever in my life. And I asked, why? What made? Because we were working on something else. And then I told parents, please let go of some of the things. Don't try to control too much and then helping your child to manage it, all kind of things. But it happened. And he told me, when my parents say, we'll see if you were able to do all what you needed to do about a week or a month, then I will consider that. For him, it was torture. Waiting for another week and a month to do well in order for him to gain that reward was torture. So instead, he just acting out. It's okay. I can lose it. I don't have to. But when parents giving it right away on that day, on that night, he was motivated to do it. Right? So instant gratification is very, very strong for them. And also, oftentimes people who are struggling with the ADHD, again, struggling or differentiated between minor and the bigger problems. They cannot distinguish because the emotional pieces are out of the way. I'm going to stop some of the educational pieces here. So this is ADHD, but probably you understood that a little bit, that ADHD is not just the behavior issues. Okay, we get that. Research has proved that a lot. But also this ADHD piece is connecting our emotional part. But think about it this, while our children is developing their brain, growing on developmental stage, right? So I'm using my hand model again. Our children in their brain when they were young, as soon as they were born again, within 2-3 months, size of the brain is the same as adult. So often our parents and adults are misunderstanding that they will know. You should know. How could they know if they've never learned? So what we are doing, parents, because we know a little bit, even if we do have ADHD, we know what's supposed to be. So we know how to teach, although we don't know how to do it. So what's happening here is, while our children are developing their brain, when they don't know how to manage their time, when they don't know how to prioritize their the important task, what we do as parents, we become their frontal lobe. So we are doing it, everything for them, managing their time, telling them what to do, what's the first, how to do that, because we know how to teach. Right? So when time comes, when our children are learning, we have to let go so that they can experience it. They will never know their weaknesses because parents are all doing it for them. But now, when the time comes, parents, okay, now you should know, you do it. But we never taught them, but we did it for them. But suddenly children are comparing, all our parents did it so well, I cannot meet that expectation anymore. Now internally they say, I am not smart enough to do that. And developing it in some way, one part of the children are saying, I cannot do anything. Another parts of the students saying, the kind of striving for the perfection. Is internally struggling constantly about that. But let's pause here. When parents are coming to the clinic, that I'm asking the question, what do you want? What do you really want your children to learn from this? They all say, I want our children to know how to manage their things and be responsible persons. So when they become adults, they can live their life. Really good. But our children were receiving it, all that executive part in a functioning way that I have to get A, I have to get into the prestigious school and then getting a certain job. Then my mom and dad, my teacher, my friends are happy. They're seeking that approval by doing these things that I am okay. Although all our parents and adults, our intention was teaching them how to do it, which means we want our children to grow up, be a person who know how to handle the difficulties, know how to manage, rather than criticizing themselves like what they're heard from everybody around them. If I'm not meeting this expectation, if I'm not doing this, I'm not good. we're in a way to teach, well, not a teach, but unknowingly we're doing it is all the task. What you do is matter. What you do will make you meaningful. You will be accepted by your society. If you don't do this, no one will hang out with you. But that is true too, right? Our children who doesn't know how to control themselves, friends don't want to play with them. That could be true. But what this system, this society's norm and expectation is teaching children and adults that if you don't do this, you're not accepted. You're an outsider. You're not significant. Then while we're growing up, what's happening is that we will look for where we can get approved. If we can't, we'll give up. So many adults' ADHD looks like this. If I cannot achieve or perfection it in something, I'd rather not do it. In the middle of it, they just give up because disappointment is a lot harder for them doing something. The significance that they're constantly seeking after cannot be met. Okay, now maybe, with the parents' help and everything, tutors, after school curriculum and everything, they went to prestigious school. Then what? There's constantly needed to compete. But again, this part, if it is neurological and brain-based the disorder, can be treatable. However, if their inner being is damaged, it will be difficult to be treated. That's the part that we do as a psychologist. Psychiatrists, they treat their brain. So after they get treated, they can still come to us. Why? Because the inner being is damaged. But again, our goal is helping and teaching our children to be a person with the character who can overcome the challenges, not to have any weaknesses in your life. So we are teaching them you cannot have any weaknesses in your life. You have to cover it up. You have to do other things, right? But if they are not meeting that, they rather not to do it, or they're doing it too much, but still not meeting the full contentment and the satisfactions. We, through all this life that we kind of see here, that weaknesses is not being positive in our society. So a lot of young adults, even the teens, that when they are pointing it out, the things that they don't do well, they're constantly being late, cannot get A and all those things. All our students were feeling that, okay, what's the point? But I have to cover it up. I have to save my face. I have to be defensive because the anger or frustration comes out of it, right? So a lot of ADHD people, because they don't want to accept their weaknesses, they often comes with a defensiveness, anger, frustration. And this ADHD comorbid with many other diagnoses. This is reason why anxiety and this. Some children comes with a oppositional defiant disorder, ODD. But we often see that it is not oppositional, but they just don't know, but constantly criticized by what they didn't do. But my approach sometimes when children are coming, it is not about that what they don't know. They just don't know how to be done. So if we want to teach them what to do, they already know. So we don't want to waste the time. I'm not just, so what do you know? Tell me. What you're supposed to know, tell me. And then they're telling me, okay, then how can we do it? Right? So our children are constantly struggling internally who they are, and also afraid, fear of having failure or mistakes, fear of rejections. fear of their weaknesses. But in life, we see not only ourselves. Let's look at all the Bible figures that we respect so much. All those figures in the Bible are accepting their weaknesses. And through admitting their weaknesses and their failure, they experienced victory. Through their weaknesses, they finally met God personally. All the work they were trying to do to receive that acceptance by somebody, meaning they still couldn't get it. Finally, they met Jesus when they're in the most vulnerable and weakest point of their lives. And now finally say, Lord, please come to me. So all this throughout all the Bible stories and figures, Jesus was building their character who can receive challenges, know how to overcome through the power who is above. Power coming from above. But without your admitting your weaknesses, it will be quite challenging. Because we know deep inside, we are not perfect. We cannot strive for perfections. So I know a person, I'm kind of giving a couple of my patients' cases with you. I know a person, and I learned from so much, that person was voluntarily showing their weaknesses, although has so much power, but voluntarily show his weaknesses. And through that weaknesses, he won the victory. His name is Jesus. Someone who has all the power, but controlled and hold that power, but voluntarily show their weaknesses. And the ultimate weaknesses that he allow himself to be perished, punished. So Isaiah chapter 53 said, surely he took up our infirmities and carried our sorrows. Yet we consider him stricken by God, smitten by him, and afflicted. But he was pierced for our transgressions. He was crushed for our iniquities. The punishment that brought us peace was upon him, and by his wounds we were healed. He was voluntarily show his weaknesses. But think about it, why he will do that? He is Almighty God. He has it all. He has all the power. But why he will voluntarily show his weaknesses and just put himself into the powerless position to get all the punishment on him on the cross? I found only one reason. He loved you and me that much. So that we are okay to save our weaknesses, that we don't have to save up our face all the time. We don't have to defend ourselves all the time, but have this assurance that we are loved and accepted and approved by God, so that we can learn from our mistakes and then receive that grace from his power and grace and love. Isn't that what we want for our children and ourselves? Isn't it so tiring for us that constantly defend ourselves, try to cover up our faiths, our weaknesses? But God is showing us, show your weaknesses. I will meet you there and I will lift you up. And that when we believe that inner side of ourselves, and that is our identity. Even if some challenges, we'll accept and know how to admit it. Okay, this is what my weakness is. How can I get better? We want our children and ourselves, the people who have a character, know how to admit our mistakes and learn from it, instead of covering it up and constantly try to seek and receive the approval by others. 2 Corinthians chapter 12, 16 to 12. To keep me from becoming conceited because of these surpassing great revelations. There was given me a thorn in my flesh, a messenger of Satan, to torment me. 3 times I pleaded with the Lord to take it away from me, but he said to me, my grace is sufficient for you, for my power is made perfect in weakness. Therefore, I will boast all the more gladly about my weaknesses, so that Christ's power may rest on me. That is why, for Christ's sake, I delight in weaknesses, in insults, in hardships, in persecutions, in difficulties. For when I'm weak, then I am strong. We can rest in God. And then now, if we receive and believe that his weaknesses made a power and deliver all of us from that agony and iniquities, so we can rest in him now, instead of boasting about ourselves, arrogant about ourselves, but what I can do more than others, what I cannot do compared to others. We can have a right and proper posture of a character, that we can have humility. At the same time, we can have a boldness. The Lord, not my weaknesses, blessed me in Jesus Christ, what he has done for me. Not because of what I can do, what I did, because what Jesus has done for me, Lord, I believe that you love me. And Jesus said, you are my beloved daughter and son. It's not about what we can do, how much we do, and we are able to manage in our lives, but be able to rest even in our weaknesses and know how to admit it, our failure, and rest in Jesus, what he has done. Whether we have ADHD or comorbid with all other issues and problems, we can find in him, because of what Jesus has done through his own weakness, willingness of putting himself in a weaknesses, he won the victory. And we find the victory in our weaknesses. So we can say, when I'm weak, I am strong. And we can ask the blessing and boldly going after God. God, look what Jesus has done for me. And God will say, my beloved son and daughter, I delighted in you. So it's not about the ADHD, the problem that we have every day. It is internal struggle that we have, why we're constantly struggling with that. Why our parents constantly nervous for our children when they're happy. That doesn't mean that we have to allow them to do that. Again, there's a treatable conditions that we needed to treat them. But our parents, let's rest. And adults who are struggling with this, find the treatments, because it's a neurochemical imbalance. Instead of finding other stimulants on the outside, find proper treatments. But at the same time, restored inner being, who you are. Things are what you cannot do. Things are you're missing. Things are you're forgetful is not determine who you are. Find the rest in what Jesus has done for us. Let's believe it in that truth, right? And it's okay, because we know within that weakness, we can find the strength. All right. Thank you so much for your time again. Hope that I share the enough concept of understanding and where we can go from here and how we needed to restart and reset our mind, even with the disorder such as ADHD. Thank you for your time today.